place of healing. Breathe slowly and deeply, finding peace within. Today we're talking about how to treat whiteheads safely, those small closed bumps that appear on your skin and sometimes feel frustrating to deal with. Whiteheads, also called closed comedones, are pores that have become clogged with oil and dead skin cells, with a thin layer of skin covering the opening. Unlike blackheads, which are open to air, whiteheads are closed, creating that characteristic white or flesh-colored bump. The safe approach to whiteheads emphasizes prevention and gentle treatment rather than aggressive extraction. Squeezing or picking at whiteheads can cause infection, inflammation, scarring, and spread bacteria to surrounding pores, creating more breakouts. Let's explore how to treat them effectively and safely. Understanding why whiteheads form helps you prevent them. Excess oil production, dead skin cell buildup, pore clogging products, hormonal fluctuations, and inadequate cleansing all contribute. Addressing these factors prevents new whiteheads while you treat existing ones. The foundation of whitehead treatment is proper cleansing. Use a gentle cleanser once daily in the evening to remove oil, dead skin cells, and debris. For whitehead-prone skin, a cleanser with salicylic acid can be beneficial. It penetrates into pores to help dissolve clogs from within. Double cleansing in the evening ensures thorough removal of everything that could clog pores. Start with an oil-based cleanser or cleansing balm to dissolve oil-based impurities. Then follow with your regular water-based cleanser. Massage your cleanser thoroughly but gently, spending extra time on whitehead-prone areas. Don't scrub harshly. Gentle, patient cleansing works better. Chemical exfoliation is key for treating whiteheads. Salicylic acid is particularly effective because it's oil-soluble and can penetrate into pores. Use a leave-on treatment with 0.52% salicylic acid 3 to 4 times weekly after cleansing. Apply to dry skin, wait a few minutes for absorption, then follow with moisturizer. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell buildup. Use 5 to 8% concentration 2 to 3 times weekly. Some people use salicylic acid and AHAs on alternating nights. Retinoids increase cell turnover, preventing dead cells from clogging pores. Over-the-counter adapalene or prescription tretinoin used 3 to 4 times weekly can significantly reduce whiteheads over time. Start slowly and be patient. Retinoids take several months to show full effects. Clay masks once or twice weekly help absorb excess oil and draw impurities from pores. Apply to whitehead-prone areas, leave for 10 to 15 minutes, rinse with lukewarm water, and follow with moisturizer. Always moisturize after treatment products. Even whitehead-prone skin needs hydration. Use a lightweight, non-comedogenic moisturizer that provides hydration without clogging pores. Don't skip sun protection. Many whitehead treatments make skin more sun-sensitive, and UV protection is essential. Choose a non-comedogenic sunscreen that won't contribute to clogged pores. For individual stubborn whiteheads, spot treatments can help. Benzoyl peroxide at 2.5% kills bacteria and helps resolve whiteheads. Apply as a spot treatment before moisturizer. Hydrocolloid patches designed for whiteheads can be applied overnight. These protect the whitehead from touching, absorb any drainage if the whitehead opens, and create a healing environment. If you absolutely must extract a whitehead, and this should be rare, do so only if it has come to a clear head and seems ready to release. Cleanse your hands thoroughly. Wrap your fingers in clean tissue. Apply very gentle, even pressure on either side of the whitehead. If it doesn't release immediately with gentle pressure, stop. Forcing it causes damage. If it does release, immediately apply a spot treatment and don't touch the area again. Better yet, consider professional extraction by a licensed esthetician who has proper tools and training. Professional facials with extraction can safely clear whiteheads without the risks of home extraction. Never use comedone extractors or other tools at home without training. These can easily cause scarring if used incorrectly. Don't pick, squeeze, or pop whiteheads that aren't ready. This spreads bacteria, causes inflammation, damages skin, and often makes the whitehead worse. Keep your hands away from your face. Don't use harsh physical scrubs, hoping to scrub away whiteheads. The particles are too large to enter pores, and harsh scrubbing irritates skin without helping whiteheads. Don't over-exfoliate thinking more will work faster. Excessive exfoliation damages your barrier and can actually worsen whitehead formation. Moderate, consistent exfoliation works better than aggressive treatment. Prevention strategies reduce new whitehead formation. Choose non-comedogenic products, skincare, sunscreen, and makeup. Heavy, pore-clogging ingredients contribute to whiteheads. Remove makeup and sunscreen thoroughly every evening. Sleeping in makeup is a recipe for clogged pores. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Don't touch your face unnecessarily throughout the day. Your hands transfer oil and bacteria that can clog pores. Manage oil production through lifestyle factors. Stress increases oil production, so practice stress reduction techniques. Adequate sleep supports skin's natural regulatory processes. Balanced diet and hydration support overall skin health. Some people find that dairy or high glycemic foods worsen their whiteheads. If you suspect a dietary connection, try eliminating these foods for a month and observe results. Be patient with treatment. Whiteheads don't disappear overnight. With consistent proper care, you should see improvement over 6 to 8 weeks. Existing whiteheads gradually resolve and fewer new ones form. Track your progress. Take photos monthly to see improvements that might not be obvious day to day. Adjust your approach if needed. If after 8 to 12 weeks of consistent care, you're not seeing improvement, you may need to adjust products, add a treatment, or consult a dermatologist. When to seek professional help? If whiteheads are severe or persistent despite proper home care, if they're causing scarring, or if they're significantly affecting your confidence or quality of life, consult a dermatologist. Prescription treatments, stronger retinoids, specific antibiotics, or other medications may be necessary. For very stubborn or large whiteheads, a dermatologist can provide in-office extraction or cortisone injections that resolve them quickly and safely. Remember that some people are simply more prone to whiteheads due to genetics, skin type, or hormonal factors. This doesn't mean you're doing something wrong. It means your skin needs consistent preventive care and patience. As we close, embrace safe whitehead treatment, gentle chemical exfoliation, proper cleansing, appropriate products, and hands-off approach. With consistency and patience, your whiteheads will improve. May your whiteheads resolve safely and completely. May you resist the urge to pick. May your skin clear with gentle, patient care. Thank you for this time together. Treat your whiteheads safely and gently. Welcome, and take this moment to breathe deeply and settle into peace. Tonight we're going to explore the double cleansing method, a gentle yet thorough approach to evening skincare that originated in Korea and Japan. Double cleansing isn't about being excessive or washing your face until it's stripped bare. It's about cleansing intelligently, removing different types of buildup with the right tools for each task. It's about being thorough without being harsh. Let's begin by understanding why double cleansing exists and what problem it solves. Throughout your day, your skin accumulates various types of buildup. There's oil-based buildup, sunscreen, makeup, sebum your skin naturally produces, and environmental pollutants that mix with these oils. Then there's water-based buildup, sweat, dirt, and water-soluble debris. These different types of buildup require different cleaning approaches. You've probably heard the phrase, like dissolves like. Oil dissolves oil, water dissolves water. Soluble substances. This is the principle behind double cleansing. A single water-based cleanser, no matter how good, struggles to remove oil-based buildup thoroughly. It might remove some, but not all. Remnants of sunscreen, makeup, and oil can remain on your skin, potentially clogging pores, preventing your nighttime products from absorbing and interfering with your skin's overnight repair process. This is where double cleansing comes in. The first cleanse uses an oil-based cleanser to dissolve and remove oil-based buildup. The second cleanse uses a water-based cleanser to remove any remaining water-soluble residue and ensure your skin is truly clean. Let's explore the first cleanse, oil-based cleansing. Oil-based cleansers come in several forms: cleansing oils, cleansing balms, and oil-based micellar waters. All work on the same principle, using oil to dissolve the oil-based substances on your skin. When you apply an oil-based cleanser to dry skin, it mixes with the oils, sunscreen, and makeup on your face. Massage it gently, and you can feel these substances loosening and dissolving. The oil breaks down even waterproof mascara, long-wearing foundation, and mineral sunscreen with ease, all without harsh rubbing or scrubbing. Here's the beautiful part. Most modern oil cleansers are emulsifying. This means when you add water, they transform from oil into a milky liquid that rinses away cleanly, taking all that dissolved makeup and sunscreen with them. No greasy residue remains. This emulsifying property makes oil cleansing completely different from simply washing your face with cooking oil, which would leave a greasy film. Emulsifying oil cleansers rinse clean, leaving your skin soft but not oily. The first cleanse is gentle yet incredibly effective. You're not scrubbing or tugging at your skin to remove makeup. You're dissolving it. This is especially valuable for your eye area, where the skin is delicate and should never be rubbed aggressively. After rinsing your first cleanse, your skin should feel clean, but perhaps still slightly filmy. That's okay. That's what the second cleanse addresses. Now let's explore the second cleanse, Water-based cleansing. Your second cleanser is your regular facial cleanser, a gel, foam, cream, or milk cleanser that's water-based. This cleanser removes any residue from the first cleanse, along with sweat, dirt, and any water-soluble debris your oil cleanser didn't address. The second cleanse is also where you can target specific skin needs. If you have acne-prone skin, your second cleanser might contain salicylic acid. If you have dry skin, you might use a creamy, hydrating cleanser. This cleanse is personalized to your skin type and concerns. After this second cleanse, your skin should feel clean, comfortable, and fresh. Not tight, not stripped, just genuinely clean. Your face is now a blank canvas, ready for your treatment products and moisturizers. Now let's discuss how to double cleanse properly. Step 1. Apply your oil cleanser to dry skin. This is important. Don't wet your face first. Your skin should be completely dry. Dispense the oil cleanser into your hands and apply it all over your face, including your eye area if you're wearing makeup there. Massage gently for 60-90 seconds. This isn't a quick swipe. Take your time. Use circular motions. Feel the makeup and sunscreen melting away. This massage time is crucial for thorough removal. Focus on areas where makeup and sunscreen tend to accumulate, around your nose, your hairline, your jawline. If you're wearing eye makeup, be especially gentle but thorough around your eyes. Step 2. Add water to emulsify. Wet your hands and add water to your face, continuing to massage. Watch as the oil transforms into a milky texture. This emulsification is the oil cleanser, binding with water so it can rinse away. Rinse thoroughly with lukewarm water. Make sure all the oil cleanser is removed. Check your hairline, jawline, and neck. Step 3. Apply your water-based cleanser to wet skin. This time, your face should be wet. Massage gently for 30-60 seconds, creating a light lather if your cleanser foams. Rinse thoroughly with lukewarm water. Make sure no cleanser residue remains. Step 4. Pat dry gently with a clean towel. Don't rub, pat. Your skin should feel clean, soft, and comfortable. The entire double cleanse process takes about 3 to 5 minutes. Yes, it's longer than a single cleanse, but the thoroughness is worth it. Who needs double cleansing? Anyone who wears sunscreen, makeup, or both. Even if you don't wear makeup, if you wear sunscreen daily, which you should, double cleansing ensures complete removal. Even people who wear just sunscreen benefit from double cleansing. Many sunscreens, especially waterproof or mineral formulas, don't remove completely with a single water-based cleanse. Remnants can clog pores and prevent your evening skincare from absorbing properly. If you wear heavy makeup, waterproof mascara, or long-wearing foundation, double cleansing is especially important. These products are designed to stay put. A single cleanse often isn't enough. Who might not need double cleansing? If you truly wear zero sunscreen and zero makeup, you probably don't need to double cleanse. A thorough single cleanse is sufficient. However, even people who don't wear products might appreciate the gentle, spa-like quality of an oil cleanse once or twice a week. Let's address some common concerns about double cleansing. Won't oil cleansers make my skin oily? No. Remember, like oil dissolves oil. Oil cleansing can actually help balance oil production. For oily skin types, oil cleansing might feel counterintuitive, but many people with oily skin find it helps regulate their natural oil production over time. Isn't double cleansing too much for my skin? Not if done gently with appropriate products. You're not scrubbing twice. You're using two different types of cleansers to address two different types of buildup. Done properly, double cleansing is thorough without being harsh. Do I need to double cleanse every day? Only at night and only on days when you've worn sunscreen or makeup. In the morning, a single gentle cleanse is sufficient. You haven't accumulated oil-based products overnight. Can I use makeup wipes instead of the first cleanse? Makeup wipes are better than sleeping in makeup, but they're not ideal. They require rubbing and tugging, they don't remove everything, and they often leave residue. An oil cleanse is gentler and more effective. What if I have acne-prone skin? Double cleansing can actually help acne-prone skin by ensuring pores are thoroughly clear of pore clogging residue. Choose non-comedogenic oil cleansers and a salicylic acid second cleanser for best results. Choosing the right oil cleanser, look for products specifically labeled cleansing oil or cleansing balm. These are formulated to emulsify and rinse clean. Avoid straight oils like coconut oil or olive oil. These don't emulsify and can leave residue. For oily or acne-prone skin, look for lightweight oils like jojoba or grapeseed. For dry skin, richer formulas with olive or sunflower oil work beautifully. For sensitive skin, choose fragrance-free formulas with soothing ingredients. Cleansing balms are solid at room temperature, but melt into oil upon contact with your skin. They're lovely to use and travel well. Cleansing oils are liquid from the start. Both work equally well. It's personal preference. Choosing the right second cleanser. This is your regular face wash, chosen for your skin type. Gel cleansers for oily skin, cream cleansers for dry skin, gentle, fragrance-free options for sensitive skin. Use what works for your skin. The beauty of double cleansing is that it becomes a ritual, a way to transition from day to night. As you massage the oil cleanser into your skin, you're not
severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually require systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, Relaxation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. Severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne.
Welcome and breathe. Settle into this peaceful moment. Today we're focusing on the delicate skin around your eyes, an area that deserves special attention and gentle care. The skin around your eyes is different from the skin on the rest of your face. It's thinner, more delicate, and has fewer oil glands. This makes it more vulnerable to dryness, more prone to showing signs of aging, and more sensitive to harsh ingredients or rough treatment. Because of these unique characteristics, the eye area often benefits from dedicated care beyond your regular face routine. Let's understand common concerns around the eyes and what causes them. Dark circles under your eyes can have multiple causes. Genetics play a significant role. Some people simply have thinner skin or more visible blood vessels in this area, creating a darker appearance. Lack of sleep causes blood vessels to dilate, making dark circles more prominent. Allergies lead to inflammation and blood vessel dilation. Aging causes fat and collagen loss, making the area appear more hollowed and shadowed. Sun damage can increase pigmentation in this delicate area. Puffiness or under-eye bags result from fluid accumulation. This can happen overnight as fluids settle when you're lying down. Allergies cause inflammation and swelling. Too much salt in your diet can lead to water retention. Aging causes fat pads under the eyes to shift and create a puffy appearance. Lack of sleep affects fluid balance throughout your body, including around your eyes. Fine lines and wrinkles appear first around the eyes because this skin is thin and moves constantly with every smile, squint, and facial expression. Sun damage accelerates their formation. Natural collagen loss with aging makes them more pronounced. Dehydration makes them more visible. Understanding these causes helps you address them appropriately rather than expecting one miracle cream to fix everything. Now let's talk about eye creams and whether you actually need one. The truth is, not everyone absolutely needs a separate eye cream. If you're young, your skin is generally resilient, and you're not experiencing specific eye area concerns, your regular moisturizer might be perfectly adequate. Many facial moisturizers are gentle enough to use around the eyes. However, a dedicated eye cream makes sense if you have specific concerns like dark circles, puffiness, or fine lines. If your regular moisturizer is too rich or contains actives that might irritate the delicate eye area, if you want ingredients specifically targeted to eye concerns, or if you simply enjoy the extra step of caring for this area specifically. The choice is yours based on your skin's needs and your preferences. There's no universal rule that everyone must use eye cream. Let's discuss what to look for in an eye cream based on specific concerns. For dark circles, look for caffeine, which constricts blood vessels and can reduce the appearance of darkness caused by visible vessels. Vitamin K supports healthy circulation and can help with vascular dark circles. Niacinamide brightens and can help with pigmentation-based darkness. Vitamin C also brightens and protects against further pigmentation. Keep expectations realistic. Eye creams can help somewhat with dark circles, but they can't completely eliminate them, especially if they're genetic. For puffiness, caffeine is again helpful as it constricts blood vessels and can help reduce fluid accumulation. Peptides support skin firmness. Cooling application helps. Keep your eye cream in the refrigerator for an extra depuffing effect. Gentle massage during application can encourage lymphatic drainage and reduce puffiness. For fine lines and wrinkles, retinol is effective for increasing collagen production and smoothing texture, but use gentle eye-specific formulations as this area is sensitive. Peptides signal skin to produce more collagen and support firmness. Hyaluronic acid plumps skin and makes lines less visible through hydration. Ceramides strengthen the skin barrier and improve moisture retention. Antioxidants like vitamin C and vitamin E protect against further damage. For general hydration, hyaluronic acid is excellent as it holds up to 1,000 times its weight in water. Glycerin is a simple, effective humectant. Squalane provides lightweight moisture. Ceramides support barrier function. Now let's discuss how to apply eye cream properly because technique matters with such delicate skin. Use your ring finger for application. It naturally applies the gentlest pressure. Your ring finger is weaker than your index or middle finger, which helps prevent tugging at delicate skin. Apply eye cream to clean skin, typically after serums but before your face moisturizer, though order can vary based on product consistency. Take a small amount, about the size of a grain of rice per eye. Eye creams are concentrated, and a little goes a long way. Using too much won't provide additional benefits and can actually cause milia, small white bumps that form when product clogs pores. Dot the eye cream along your orbital bone, the bony area that surrounds your eye socket. Place dots under your eye from inner to outer corner, along the outer corner, and on your upper lid if the product is suitable for that area. Gently pat the product into your skin using your ring finger. Don't rub or pull. Pat, 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 moving from inner corner outward and upward. This gentle patting motion helps with absorption without traumatizing the skin. Avoid getting product directly on your eyelid margin or too close to your lash line. Product can migrate into your eyes, causing irritation. Stay on the orbital bone area. Apply eye cream morning and night, or just at night if you prefer. Consistency matters more than frequency. Some people enjoy using an eye serum underneath their eye cream for extra treatment benefits. If you do this, apply the serum first, let it absorb, then apply your eye cream to seal it in. Let's talk about what to avoid in the eye area. Never pull, tug, or rub the skin around your eyes roughly. This delicate skin doesn't bounce back well from trauma. Always use gentle patting or pressing motions. Be cautious with harsh active ingredients. While retinol can be beneficial for the eye area, use formulations specifically designed for this sensitive region, or use your facial retinol very carefully, avoiding the immediate eye area. Avoid getting facial products with strong actives directly in the eye area unless they're specifically labeled as eye safe. AHAs, BHAs, and strong vitamin C formulations might be too irritating for this delicate skin. Fragrance and essential oils are common irritants. In eye products especially, fragrance-free is often safer. Be careful with sunscreen around the eyes. Some sunscreens sting if they get into eyes. Look for mineral sunscreens or those labeled as suitable for the eye area. Wearing sunglasses provides extra protection. Now let's discuss additional ways to care for your eye area beyond just product application. Sun protection is crucial. The skin around your eyes is vulnerable to sun damage. Wear sunscreen daily, carefully applied to avoid eyes, and wear UV protective sunglasses when outdoors. Sunglasses also help prevent squinting, which contributes to wrinkle formation. Stay hydrated. Dehydration makes fine lines more visible and can worsen dark circles. Drink adequate water throughout the day. Get sufficient sleep. 7 to 9 hours allows your body to repair and reduces puffiness and dark circles. Elevating your head slightly while sleeping can help prevent fluid accumulation that leads to morning puffiness. Manage allergies. If allergies, welcome and breathe with me, in and out. Let any stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone, you're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH balanced cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta-hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment. Acne can affect your self-esteem, your confidence, your comfort in social situations. These feelings are valid and real. You're not being vain or superficial for caring about your skin. Be kind to yourself. Speak to yourself the way you would speak to a dear friend struggling with the same issue. Your worth isn't determined by your skin's clarity. You're valuable, worthy, and deserving of love and respect, regardless of whether you have acne. When you look in the mirror, try to see your whole self, not just your skin. Notice your eyes, your smile, your unique features. Acne is temporary. It will improve with consistent care, but you are so much more than your skin. If acne is severely impacting your quality of life, causing painful cysts, or not responding to over-the-counter treatments, please see a dermatologist. There's no shame in seeking professional help. Dermatologists have access to prescription-strength treatments that can make a significant difference. You don't have to suffer or struggle alone. For acne scarring and marks, be patient. Red or dark marks left after pimples heal will fade with time, usually several months. Sunscreen is crucial for preventing these marks from darkening. Ingredients like niacinamide, vitamin C, and retinoids can help speed up fading. True depressed or raised scars may require professional treatments like chemical peels, microneedling, or laser therapy. But wait until your active acne is well controlled before pursuing these options. As we come to the close of our time together, remember these core principles. Be gentle with your skin. Use effective ingredients consistently but not harshly. Give treatments time to work, at least 6 to 8 weeks. Moisturize even though you have oily skin. Protect your skin with sunscreen. Don't pick or squeeze. Manage stress and care for your overall well-being, and above all, be patient and kind with yourself. Acne is frustrating, but it's treatable. With consistency, gentleness, and time, your skin can improve. The routine we've discussed isn't complicated or expensive. It's simple, sustainable, and effective. Take a deep breath in and release. You have everything you need to care for your acne-prone skin with gentleness and effectiveness. May your skin heal. May you have patience with the process. May you treat yourself with the same compassion you'd offer to anyone you love. Thank you for this time together. Be well, be gentle, and trust the process. Cleanser to remove any remaining residue. Antioxidants are your internal defense against pollution damage. Antioxidants neutralize free radicals before they can damage your skin cells. Incorporate antioxidant-rich serums into your routine. Vitamin C is particularly effective, as are vitamin E, niacinamide, resveratrol, and green tea extract. Apply antioxidant serum in the morning under your moisturizer and sunscreen. This provides a protective shield throughout the day. Some sunscreens also contain antioxidants for added protection. Physical barrier protection helps too. In extremely polluted environments, consider wearing a face covering when outdoors, not just for general health, but to reduce direct contact between pollution particles and your skin. Keep your skin's barrier strong. A healthy, intact barrier is more resistant to pollution penetration. This means consistent moisturization, gentle care, and avoiding anything that compromises your barrier like harsh products or over-exfoliation. Let's discuss temperature extremes and how to protect your skin from both cold and heat. Cold weather and dry winter air create significant stress for your skin. Low temperatures constrict blood vessels, reducing circulation to your skin. Cold air typically has very low humidity, drawing moisture from your skin. Indoor heating further dries the air. Wind compounds the problem, physically abrading your skin's surface. Protecting your skin in cold weather requires several strategies. First, adjust your skincare routine. Switch to richer, more nourishing moisturizers that provide better barrier protection. Apply moisturizer more frequently, perhaps morning and evening and even midday if your skin feels tight. Consider adding a facial oil as a final step to seal in moisture and provide extra protection against harsh air. Physical protection is crucial. Cover your face with a scarf when outside in very cold or windy conditions. This creates a barrier between your skin and the harsh air. Apply a thick layer of moisturizer or a protective balm before going outside. Think of it as a shield for your skin. Use a humidifier indoors, especially in your bedroom. Adding moisture to the air dramatically reduces the rate at which your skin loses hydration. This simple step can transform your skin during winter months. Avoid very hot showers and baths, tempting though they are in cold weather. The hot water strips your skin's natural oils, making dryness worse. Use warm water instead and limit bathing time. Apply moisturizer immediately after bathing while your skin is still damp. Hot weather and high humidity present different challenges. Heat can increase oil production and bacterial growth, potentially worsening acne. High humidity can make skin feel congested. Sweat, while natural and healthy, can mix with sunscreen and makeup, clogging pores if not cleansed properly. Protecting your skin in hot weather means staying cool when possible. Seek air-conditioned environments during extreme heat. Wear light, breathable fabrics. Use lightweight, non-comedogenic skincare products that won't feel heavy or clog pores. Gel or water-based moisturizers often work well in hot, humid climates. Cleanse gently but thoroughly after sweating. You want to remove the sweat, oil, and any dissolved sunscreen or products, but still be gentle to avoid stripping your skin. Carry gentle cleansing wipes or micellar water for quick cleansing if you can't access a sink immediately after exercising or being in heat. Stay hydrated internally. In hot weather, you lose more water through sweat, and your skin needs adequate hydration from within to maintain itself. Drink water consistently throughout the day. Wind protection is straightforward but often overlooked. Wind physically damages your skin, causing irritation, dryness, and over time, a weathered appearance. When spending time in windy conditions, protect your face with scarves, balaclavas, or simply by positioning yourself out of direct wind when possible. Apply a thicker moisturizer or protective balm before wind exposure. This creates a physical barrier that reduces wind damage. After exposure, cleanse gently and apply nourishing moisturizer to repair any damage. Indoor environmental stressors deserve attention too. Central heating in winter and air conditioning in summer both create very dry air that stresses your skin. The solution is the same: humidifiers to add moisture to your environment and consistent, adequate moisturization of your skin. If you work in an office with air conditioning, consider keeping a hydrating facial mist and moisturizer at your desk. A midday moisture boost can make a significant difference in how your skin feels and functions. Chlorine from swimming pools is harsh on skin, stripping oils and disrupting pH balance. If you swim regularly in chlorinated pools, rinse your face immediately after swimming. Apply a pH balancing toner and generous moisturizer to restore your skin. Consider applying a thin layer of natural oil or balm before swimming to create a protective barrier between chlorine and your skin. Blue light from screens is an emerging concern. While research is still developing, there's evidence that prolonged exposure to blue light from computers, phones, and other devices may contribute to premature aging and hyperpigmentation. Some sunscreens now offer blue light protection. Antioxidant serums may also help protect against blue light damage. Most importantly, practice good screen hygiene. Take breaks, dim your screens, and use blue light filters on your devices, especially in the evening. Let's talk about how to strengthen your skin from within to better withstand environmental stress. A diet rich in antioxidants provides internal protection against environmental damage. Colorful fruits and vegetables, particularly berries, leafy greens, and orange vegetables, are packed with protective compounds. Omega-3 fatty acids from fish, nuts, and seeds support your skin's barrier and reduce inflammation. Adequate protein provides the building blocks for skin repair and regeneration. Hydration from within is crucial. Your skin can only maintain its moisture balance if your body is adequately hydrated. Drink water consistently throughout the day. Herbal teas count toward hydration. Water-rich foods like cucumbers, watermelon, and citrus fruits also contribute. Adequate sleep supports your skin's ability to repair environmental damage. During sleep, your skin goes into repair mode, fixing damage accumulated during the day. Without adequate sleep, this repair is incomplete, and environmental damage accumulates over time. Stress management reduces inflammation throughout your body, making your skin more resilient to environmental stressors. Chronic stress weakens your skin's barrier and its ability to defend against external challenges. Whatever helps you manage stress, meditation, exercise, time in nature, creative pursuits, is indirectly protecting your skin from environmental damage. Now let's discuss how to create a protective skincare routine that addresses environmental stress. Morning routine for environmental protection. Cleanse gently or rinse with water. Apply antioxidant serum, vitamin C or other protective antioxidants. Apply moisturizer appropriate for current weather's environment. Apply broad-spectrum sunscreen, your essential environmental shield. If needed, add a protective balm to areas particularly exposed to elements. Evening routine for environmental recovery. Cleanse thoroughly to remove all environmental buildup from the day. Consider double cleansing if you've been in polluted or harsh environments. Apply hydrating and barrier-supporting products. Use richer, more nourishing moisturizer to support overnight repair. Consider adding a facial oil for extra protection and nourishment. Weekly additions. Gentle exfoliation. Once weekly to remove environmental buildup and encourage cell turnover. Hydrating or antioxidant masks to boost your skin's resilience. Extra attention and products on weeks when environmental stress was particularly high. Adjust this basic framework based on your specific environmental challenges. If you live somewhere very polluted, emphasize thorough cleansing and antioxidants. If you face extreme cold, emphasize rich moisturization and physical protection. If you're in intense sun, emphasize sun protection and after-sun repair. Pay attention to seasonal transitions. Your skin needs different protection in different seasons. Adjust your routine as weather changes, giving your skin what it needs for current conditions rather than following the same routine year-round. As we come toward closing, embrace this empowering truth. While you cannot control all environmental stressors your skin faces,